seeing India come out with shining colors as far as the management of COVID is concerned, and from the perspective of the fact that we now are exporters of a large number of protective equipment as also of vaccines. India has supplied vaccines manufactured in this country to 70 countries. And India itself, because it is reeling with the impact of COVID, has had to do a lot of cleansing up, so to say, in its own backyard because of the fact that COVID spares no one. We have a very eclectic mix of a panel today for the discussion on realizing the opportunities of medical value travel, given the scenario that COVID is here. And what we are really playing is a test match, as an article has just mentioned, rather than a one day or a T20 match. So it's something that we all have to put our brains together to think of a solution as to how medical value travel can benefit the healthcare industry, the image of the government of India, because this provides soft power. And the third, most important, is what can India do to help our friendly countries and neighboring countries from where we get a lot of medical value travel, because we provide cheaper medical tourism potential than any other country anywhere else in the world. And we have the wherewithal to provide it because our medical services are equal to any developed country in the world at one-fourth the cost. Niti Aayog and Ministry of Commerce included medical value travel as one of the 12 champion industry sectors they wish to promote under the Promotion Council. It is also a fact that a UN Travel Council declared a couple of months ago that 60 to 80% of the travel industry traffic was affected because of COVID. So when travel is so badly affected, it is but natural that the impact of it will be felt on medical tourism. Because if the patient cannot be transported to the country of his or her choice, then whom are you going to treat? Otherwise, the entire medical travel industry was pegged at around $87 billion. It is estimated that some estimates point to 25 to 30 billion, others point to $50 billion having already been affected. You will be hearing from an expert panel today as to how to meet these challenges. What are they? What is the infrastructural challenge? Can the teleconsult or telemedicine concept, the importance of which is being increasingly felt? Today, this meeting might well have been held in person, but we are actually face to face with one another. And this, the same could be probably transported onto providing some medical solution to people in need. So this is an area where we need to discuss how India can bounce back by transforming its medical value travel sector, utilizing the technological advances that are available to us because of the IT sector being one of the leading sectors in India, and the fact that we have a thriving medical tech sector, we have an excellent medical services sector. And can these three somehow mesh together in providing a platform that will work for the benefit of not just the medical tourism industry, the government itself, but also provide succor and relief to the people who need it most? What opportunities does the convergence of technology, medtech, and of course the telecom sector provide to bring about this kind of a thinking is what needs to be discussed. What help does the telemedicine sector seek from the government in terms of policies? What help can the government provide to the private sector industry? Can it do something what Malaysia has done, for example, in providing fiscal support, tax support, etc., etc., or perhaps even having a relationship that Malaysia built with Oman, with Libya, and with Kazakhstan to become the partner of choice. Can such a conglomeration of the industry with the government work to the benefit of the medical sector and also to the patient's benefit? These are some of the questions that we'll be taking up with this very eclectic panel that we have with us today. So let me first introduce you to the first speaker of the day, who is Mrs. Sangeeta Saxena. She's Director, TPD, Department of Commerce, Ministry of Commerce and Industry, Government of India. Ministry of Commerce and Industry of India and FICCI have been working very closely together for several years in promoting medical value travel, or medical tourism, as many call it, for the Indian sector. And we are very grateful for having Mrs. Saxena with us today. Over to you, ma'am.
Thank you, Dr. Puri, and a very good morning to all the panelists and also the wider audience that is here today for this discussion on telemedicine about realizing the opportunity in the medical value travel sector. So as Dr. Puri also mentioned, that FICCI and Department of Commerce have been working very closely over the past few years in the sphere of medical value travel, and a lot of industry inputs through FICCI have come to the department, and we have taken it up with the other stakeholder ministries. Not only this, as was mentioned in the introduction, Department of Commerce has identified 12 champion services sectors for focused attention, in terms of development of their capacities and the value addition domestic and as well as abroad, and also in terms of the exports. Medical value travel is one of the key champion services sector, and we've been very deeply involved with the export potential of this sector. Having said that, also the telemedicine, which is what we call as mode 1 export services, where the services happen it's a service which crosses the border. Neither the consumer nor the supplier crosses the border. It's only the service which crosses the border. And this advancement in technology has been of great benefit, especially in such challenging times as the current pandemic that we are facing. And not only this, it also saves costs and efforts, and we've been able to integrate the people who were till now not integrated in terms of the rural hinterlands, or even countries which were beyond such connection in terms of the physical presence of the medical services suppliers. It also reduces the burden on the hospitals as well. So it is now gradually becoming the first point of contact for any patient, and that is something which kind of facilitates the entry into the medical supply arena. There are also certain other benefits which probably other panelists would also like to talk about, and that is they have a higher likelihood of maintenance of records in a telemedicine setup rather than in any other conventional setup. And as I mentioned, the patient's safety as well as the health workers' safety, which is of paramount, is something which is this particular medium allows us to work towards that, and it's especially where there is a risk of contagious infections. And needless to say, the disasters and the pandemics that we have seen in the past 1 year have completely changed the landscape of consultations in the medical sphere. As the government, also equally committed to providing equal access to quality care, and I see some very eminent panelists from the government side as well, who will talk about some initiatives which have been taken by the government. So on e-Sanjeevani or the National Health Stack and so on and so forth. I would also like to say not only telemedicine, but it is also supplemented by a whole bunch of digital technologies. For instance, we have 3D printing, we have artificial intelligence. So with all these supplementation by these technologies, telemedicine is becoming the key driver of healthcare delivery. And we all know about the 3D printed hearing aids, or even the Jaipur foot, which is customized and it offers that advantage. And we have also heard about artificial intelligence being used to give the paraplegic patients to improve their mobility and manage road traffic. And one of the important things that digital technologies is being used is to improve the training and the performance of health workers. And overall, all of this, the entire telemedicine setup today is also empowering us to move to you envisaged. Nevertheless, there are a lot of challenges which we face here. One is, of course, the access to technology, and there is a very deep digital divide, which we need to address, and that digital divide, and I'm talking about here not only in India but also elsewhere in the world. So the access to that technology is something which needs to be addressed. We also know that these there are in the sphere of medical value travel, there is also a limitation of, for instance, the health insurance coverage is something which is not portable, and I'm not very sure whether that covers telemedical consultations as well. So that is a point which we perhaps need to take forward, about having the portability of or having the health insurance coverage for telemedicine as well. Then there are issues related to the data privacy and data security, and these are very confidential data which we need to address it in the right proper way. We also have issues related to the restrictions. Earlier, the telemedicines, we did not have any guidelines, we did not have any anything to say that this is the practice of telemedicine, and there had been concerns regarding the practice of telemedicine. But as you're aware that the Government of India has come out with the telemedicine guidelines, which will help realize the full potential of the advancements in technology, and it provides the norms and the protocols relating to physician and the patient relationship, the issues of liability, negligence, informed consent, medical records, privacy and security of the patient records, and also the counseling. And these guidelines obviously has provided the basic foundation and the contours of telemedicine in India. And as a thought, in terms of the medical value travel space, it would be useful if there is a recognition of these guidelines by the countries, the source countries, so that then these guidelines are recognized by the other countries, and therefore they facilitate in the telemedicine consultations in the source countries for medical value travel. Government of India has also set up various other things. Of course, e-Sanjeevani, I will not talk about much because I already see Dr. Sanjay Sood here on e-Sanjeevani. But that is again one of the initiatives, one of the big initiatives. And one thing which really, when I read about e-Sanjeevani, which really was highlighted the inclusiveness part of it, was that e-Sanjeevani was being used to offer medical services to inmates of Palakkad jail in Kerala, and also in providing healthcare services to old age homes in Himachal. That, I think, gives or highlights the power of telemedicine. The fact that we're able to reach people who have till now not been included, or it's difficult for them to be included in the physical setup. And that extends to the medical value travel sphere as well, where we are talking about getting patients for medical treatment here in India. This serves as the first point of contact, and we need to taken forward thereafter. We also have other applications like CoWIN, which is there for real-time monitoring of COVID-19 vaccine delivery. And we've seen that India is the top few countries where the vaccination drive has been launched and is currently ongoing. We also have the National Health Portal and various mobile apps like NHP Indradhanush, NHP Swasthya Bharat, Mera Aspatal. They have also been launched. The National E-Health Authority, which is the regulatory and the promotional organization to strategize the e-health adoption, has also been set up. We have the National Health Stacks, and we have other panelists who would be talking about that. And all of these initiatives come together to facilitate the telemedicine sphere. In fact, coming to the medical value travel and telemedicine, India has launched e-Arogya Bharti. It is a project by the Ministry of External Affairs, where we have telemedicine consultations with a group of African countries. In fact, the precursor was the Pan Africa E-Network project, and now it has been taken over by the e-Arogya Bharti. And we have countries like Benin, Congo, Ghana, Malawi, Mauritius, Mozambique, Guinea, Zambia, Sudan, and Uganda. And the pilot project in Ghana has been underway. And this has been received by the African countries with much enthusiasm. And not only telemedicine, this project also offers continuing medical education for African doctors, paramedics, and patients. And these services are, of course, provided by the Ministry of External Affairs in partnership with the Ministry of Health and Family Welfare and the Center for Development of Advanced Computing and other stakeholders. So broadly, the initiatives which have been undertaken by the government, along with all the inputs that we have received from the industry from time to time, have helped us move forward in this sphere. And I look forward to the valuable inputs that this esteemed panel will give to us today, and so that we are able to take it forward to the next logical step. So thank you so much for this opportunity, and I'm listening with the great interest what the other panelists have to say. Thank you.
Thank you, Geetaji. You referred to the Pan-African Network. I can tell you many people, many faces that you see on the screen today from the industry side have had experience, as I have had personally, of the Pan-African Network. And it's a good network and a good way to communicate, particularly with the African countries. Many of our hospitals have participated in this in the past, and we look forward to participating now. May I now request Mr. Amar Aram Gurjar, Director, East and South Africa, Ministry of External Affairs, or rather East and Southern Africa, Ministry of External Affairs, Government of India. Mr. Gurjar, please.
Good morning to everyone. Thanks, Dr. Puri, Advisor, FICCI Medical Value Travel Committee, and esteemed panelists and speakers, and respected audience and participants. First of all, I would like to express my sincere thanks to FICCI for giving me an opportunity to make a brief remark on today's theme, telemedicine, realizing opportunity in medical value travel. With regard to the today's theme, just let me allow to speak on this theme in Africa's perspective. As Dr. Puri has mentioned that I am looking after East and Southern Africa in Ministry of External Affairs. Therefore, it is an appropriate for me to speak in African context. Many of us very much well aware about that Africa faces a major challenges in the health sector, particularly in the form of health workforce, including shortage of doctors, nurses, paramedics, pathologists, and all classes of healthcare professionals. It is reported that Africa has a very low density of physicians and nurses. This is also reflected in hospital beds and specialized medical equipment. Uh, African countries have also been grappling with the threats posed by many communicable diseases like HIV, AIDS, malaria, tuberculosis, Ebola, etc. All these factors were the principal force behind African Union's initiatives to improve healthcare in African continent. I would like to mention here two initiatives which were taken by African Union and continental level. First, it was the Agenda 2063, which ensures every citizen in Africa would have a full access to affordable and quality healthcare services. Agenda 2063 also aims to achieve self-reliance in healthcare system, and the another initiative was taken by African Union to establish Africa Centers for Disease Control and Prevention, which is called Africa CDC, which is headquartered in Addis Ababa. Africa CDC's aims is just to support the public health initiative of member states and strengthen the capacity of their health institutions to deal with the disease threats. In these two initiatives, I believe that India, being a pharmacy of the world, can play a vital role in achieving African Union's goal under Agenda 2063. Indian pharmaceutical companies, which we all know that have all expertise, capacities, and technical know-how in controlling these kind of diseases, particularly AIDS, TB, malaria, etc. For instance, Cipla, the Indian generic firm, has taken the initiative to reduce the cost of HIV/AIDS treatment by bringing down the cost of.
Mr. Gujjar, I'm sorry to interrupt. Can you please open your camera?
Yes, yes, no, yes, sorry. Yes, I was mentioning that, for instance, Cipla, the Indian generic firm, has taken the initiative to reduce the cost of HIV/AIDS treatment by bringing down the cost of antiretrovirals ARVs below $1 per day, which is a very much affordable in many of African countries. Another Indian pharma company, Ranbaxy Laboratories, also launched the drug Cinerium, which it also claims will prove a more efficient and simpler treatment for malaria also. So I would like to mention here that it is a matter of great satisfaction for us that major Indian pharma companies have their strong presence or manufacturing facilities in African nations. For example, Cadilla's facility in Ethiopia, Ranbaxy in Nigeria, Cipla and Lupin Limited in South Africa, etc. Government of India has also been trying to help African countries in providing the medical equipments and capacity building for their workforce, medical and healthcare workforce. Government of India has also donated a Bhabatron nuclear imaging medical equipments to Kenya, Uganda, Madagascar, Malawi, and Tanzania. Now I come to the telemedicine. What my previous speaker, Ms. Sangeeta, has mentioned about the Ministry of External Affairs flagship scheme, uh, Pan Africa E-Network, which was renamed in 2019 as E-Arogya Bharti and E-Vidya Bharti. So telemedicine project has become a milestone in India-Africa relations. Through this mechanism, medical practitioner at the patient and location in African can consult online Indian medical specialists in various disciplines, specialists selected by African Union for its member states. African patients can also have a telemedicine and continue medical education through video sessions for live diagnosis and advice by the doctors on a scheduled time in association with the provider, super specialty hospitals, and the receiver and the remote telemedicine center. Uh, I was just informed that the patient consultation centers have already been set up in more than 12 Indian super specialty hospitals in India. At present, the telemedicine consultations are regularly being conducted from these super specialty hospitals in India to the African countries on need basis. The India-Africa digital partnership has been accelerating the pace of healthcare deliveries in Africa. The telemedicine network also provides continuing medical education services based on the selected super specialty disciplines in the medical courses. I would like to highlight here that India has been helping the African countries in bridging the digital gap through launching the Pan-Africa e-network at the continental level since 2009. As the first phase of this program was over in 2017, under which I want to mention that 21,280 African students got benefited from various UG, PG certificate programs, and 8,500 students were also awarded degrees under this program. And this program was renamed Vidya Bharati for tele-education and e-Arogya Bharati for a telemedicine in 2019. And it has been implemented by Ministry of External Affairs through TCIL under the South-South Cooperation. E-Vidya Bharati, under this program, we are offering 50,000 scholarships over a period of 5 years. So far, 17 countries in Africa have already signed the Memorandum of Understanding with the implementing agency, the TCIL, to become partner countries. Apart from e-Vidya Bharati and Arogya Bharati, Government of India also offers various short, medium and long-term courses, training courses in healthcare sector under its ITEC program for capacity building of African paramedics and doctors and nurses. As we all are aware that we always believe in Vasudhaiva Kutumbakam, this age-old tradition and philosophy has been practiced in a true manner during COVID pandemic. As a time-tested partner to Africa, India has kept open its supply line, especially medical and food aid. Even during the lockdown and COVID pandemic, India has supplied essential medicines and life-saving drugs to 150 countries across the globe. With regard to Africa, which falls in my domain in MEA, we have provided medical assistance worth Rs 1.22 crore each to 25 African nations on a grant basis in the forms of supplies of hydrochloroquine tablets and 16 other essential life-saving drugs. Each country was also gifted 1 lakh tablet of SCQ with a total value of around Rs 0.88 crore. Around 150 tons of medical aid worth Rs 40 crores delivered to the continent of Africa. And under the Vaccine Maitri initiative, Government of India has also supplied more than 60 million doses of made in India COVID vaccine to 75 countries worldwide and UN healthcare workers as well as the COVAX Gavi Alliance. In this above remark, in conclusion, I want to make here that Africa needs international cooperation from all across the globe to achieve its goal in health sector for SDGs and African Union's Agenda 2063. Medical diplomacy going to be an important pillar in India-Africa relations. And we should encourage various stakeholders in India, including private pharmaceutical companies, Indian hospitals, which can play an important role in this direction to just enhance the capacity building for the African nations. In this my remark, once again, I would like to thank FICCI for offering me this platform to share my views on telemedicine in India-Africa context. Thank you very much, Dr. Puri, and thanks very much to everyone for your kind patience. I wish FICCI all success for its future endeavors. Thank you very much.
Thank you very much, Mr. Gurjar. Great hearing from you about the delivery, particularly in COVID times, of the tablets that you mentioned, the HCQ, and the help that Indian government has been providing in form of vaccines. May I now request Mr. Sanjay Sood, Project Director of eSanjeevani Portal, CDAC, to give his views on the potential and the way forward as far as the telemedicine part of the telehealth is concerned, particularly in relationship, as I mentioned at the beginning, of the COVID pandemic affecting the medical tourism industry. Thank you, Dr. Sood. Please go ahead.
Thank you so much, Puri sir. At the outset, I would like to thank my superiors at Ministry of Electronics and IT, CDAC, and of course, Ministry of Health and Family Welfare to to give me this opportunity to share my views about telemedicine with the topic which is so significant or so relevant in these corona times. In fact, to start with, I would like to mention that Government of India developed telemedicine technology way back in I would say 2001 and 2002. And it was Sanjeevani in those days that we had put together as the indigenous telemedicine technology at Center for Development of Advanced Computing in Mohali, wherein we tried this technology in the days when telemedicine was not much heard of, and people very often would misinterpret it as medical transcription. In those days, we did not have much to look up to, so we sort of had very little to explore around. It is just that we, as the technologists in the country, put together this technology and indigenous and then ensured once it was rolled out in 2002 at the leading tertiary level hospitals in the country for the specialists in AIIMS New Delhi, PGI Chandigarh, and Sanjay Gandhi PGI in Lucknow. Since then, along with, at pace with the rapid developments in the domains of IT and internet or the communication technologies, Sanjeevani had been evolving at a very rapid pace. And during the course, we were fortunate enough to see that Government of India had sort of adopted eSanjeevani or Sanjeevani as the flagship telemedicine technology of the Government of India. And in the process, for Ministry of External Affairs, Government of India, we put together the telemedicine networks, international telemedicine networks in the countries like Myanmar. We implemented telemedicine in Tanzania and Africa, and then Kyrgyzstan and Armenia as well. And these networks were implemented way back in between 2005 and 2015. The last one was in 2015 in Kyrgyzstan, and the first one was in 2005 and 6 in Myanmar. And these telemedicine networks were majorly set up using India's indigenous Sanjeevani technology, telemedicine technology. And since then, we've been in touch with some of the practitioners in these countries who've been practicing telemedicine using the eSanjeevani technology. And they were really excited to have this kind of technology, which enabled them to see patients in their countries from a distance or remotely. And then as we were working towards the larger projects under the world's largest health insurance scheme called Ayushman Bharat for the Ministry of Health and Family Welfare, we were again recommended by the Ministry of Health and Family Welfare to Ministry of External Affairs, as Gujar sir just mentioned, and even Sangeeta ma'am mentioned, e-Arogya Bharati project. Sanjeevani has been shortlisted as the technology to be implemented across African continent in over around 50 countries in Africa. And we've already done pilot rounds with Zambia, and Ghana is also in the process of maybe gearing up to run these pilots. The doctors in these countries, in Zambia specifically, they shared some radiological studies with the doctors in PGI Chandigarh and the AIIMS New Delhi, and they tested the technology, that is eSanjeevani, feasibility and the relevance and the utility in terms of having it used for this Pan-African or rather intercontinental telemedicine network. The results have been quite good, and we ran these pilots in the months of February, just before the COVID touched the Indian shores. And as soon as the telemedicine practice guidelines were rolled out or issued by the Government of India, or rather the then Medical Council of India, we were once again pressed into the action to put together a platform which could be used nationally and could provide health services to the patients in the confines of their homes. So we put together eSanjeevani OPD, which which enabled remote consultations between a patient and a doctor. The experiences have been excellent. It has been equally, or I would say very encouragingly adopted by the patients as well as the practitioners, and it has got rolled out in something like 31 states in the country, which is close to around 90% of the populace in the country is already having access to e-Sanjeevani or telemedicine services in the country. And today we are doing around 46,000. The peak that we've touched just a couple of days earlier is 46,000 consultations, or we've e-Sanjeevani serving 46,000 patients every day. It is 40,000 plus in just to average it out, and we've already clocked over 3.4 million consultations. And the policymakers, the practitioners, and even the patients, they are all confident about telemedicine technology, that it can be that vital link which can not only improve the economy, but also improve the health indicators, and also bridge the digital divide which exists between various, I would say, various sectors, like within the country, it could be the urban and the rural sectors, and between the nations, it could be the countries which are on the other side of the digital divide. And this experience has really sort of infused a lot of confidence, especially in the practitioners who were earlier not all that open for using this kind of technology in their practice because of the regulatory and the legal aspects, which sort of raised challenges for them. But now that we do have on e-Sanjeevani network in the country, we have over 30,000 clinicians who've been onboarded and who've been trained on the digital health technology. And we do have clinicians who've done over 30,000 medical consultations using e-Sanjeevani, that is telemedicine consultations. And with these kind of figures, we can say that telemedicine is here to stay for long, and it is a technology which is certainly being preferred in these times. And with the experience that we've had over through e-Sanjeevani, we can say that it has emulated, or it has sort of, we've been able to simulate the linkages between, or rather it could be inter-country or inter-nation telemedicine, because we have tertiary level hospitals like AIIMS in Bathinda, Punjab, where the specialists or super specialists are extending services or providing services to the patients in other states like Uttarakhand. And these kind of consultations are really adding a lot of value to the entire medical practice, and the patients are also comfortable. And we can thus ensure that with this kind of technology, India has sort of leapfrogged internationally or globally to a position where India can claim to be I guess one of those very few countries, no more than 2 or 3 countries, who already have this kind of technology being used at national scale. And we can say that with e-Sanjeevani, which has also been integrated with a lot of diagnostic devices, if we extend it, if we extend this kind of a technology beyond borders, it will certainly bring all the value which the patients would ideally need in the pre-operative and as well as the post-operative consultations with the doctors. And because we are already experiencing pre-operative and post-operative consultations on e-Sanjeevani, and the results are quite encouraging. So we look up to the policymakers, the industry, and also the practitioners to see that the benefits of this kind of technology reach the populace beyond borders as well. And with this, I would like to thank the co-panelists and Narottam Puri sir and Mr. Mittal and Aparna ma'am from FICCI for giving us this opportunity. We'll be happy to address any questions those you may have. Thank you very much, sir.
Thank you, Dr. Sood. Like Sangeeta ji and Mr. Gurjar, we'd request you to stay with us, because at the conclusion of the seminar, we may have many questions from the participants.
Sure,
now I'm
sir.
going to request Mr. Abhishek Kumar, who is the Director, National Health Authority of India, Dr. Sanjay Sood has just given an idea about what the potential for telemedicine is within the country, and the potential also exists outside the borders, as he said. I'm sure that Mr. Kumar will build on what is required, because the NHA is really the authority as far as health services are concerned. So it will be lovely to listen to you. Mr. Kumar, we do know that because of time constraints, you will not be able to stay with us during the duration of the rest of this particular seminar. Therefore, any questions that the participants may have to Mr. Kumar may be asked at the conclusion of his 7-minute talk, which he will start now. Over to you, sir. Please unmute yourself. Please unmute yourself.
Mr. Kumar, we can't hear you.
Hello.
Seems to be some audio problem. Do stay with us. It shouldn't take too long to sort out. From the perspective of the inputs that we have been provided with so far by the three eminent speakers prior to this, it is very obvious that, yeah, Mr. Kumar is back, hopefully with his audio in position. Over to you, sir.
Yeah, thank you. Am I audible now?
Yes, you're audible. Please go ahead.
Yeah. So telemedicine has become very important and commonly used term as far as medical services are concerned. And the credit goes to unfortunate arrival of COVID, because after COVID, there was a premium on getting medical services without physical visit or physical connect. So there is absolutely no doubt that everybody is looking for telemedicine as far as effective delivery of medical services are concerned. Now, prima facie, it may appear that telemedicine can be leveraged using technology, just like so many other sectors where we are leveraging technology for effective delivery of goods and services. But there is one fine difference. Unlike any other e-marketplace, when we talk about telemedicine or effective delivery of medical services, the major distinction and the most fundamental distinction is that we are dealing with the lives of people. So this is a very fine difference, and it impacts everything related to telemedicine, be it legal and regulatory framework, be it development of technological platform to deliver it. So each and every aspect becomes very important. Now, coming to unlocking the potential of telemedicine, there are two major aspects to it. First major aspect is legal and regulatory framework. Legal and regulatory framework needs to be absolutely clear as well as pragmatic to ensure that telemedicine flourishes. Second point is development of technological platform or technological ecosystem, I will say, because when we talk about telemedicine, it is not about development of some standalone digital system which alone can unlock complete potential of telemedicine. Rather, it is about development of a complete ecosystem through which full potential of telemedicine can be leveraged. Now, these two aspects, legal and regulatory aspects and development of technological platform, these two are very closely interlinked, because whatever technological platforms are developed, whatever technological ecosystem is developed, that has to be in line with the legal and regulatory framework. So let me talk a little bit about National Digital Health Mission in this context. As on date, National Health Authority has been entrusted with the responsibility of implementation of National Digital Health Mission. And National Digital Health Mission seeks to create a national digital health ecosystem. So when we say national digital health ecosystem, it means to create an interoperable health ecosystem. As on date, as we know, in a health ecosystem, there are various kinds of digital interventions, but they are in silos. They are not interoperable. So different systems can't talk to one another. And that is where National Digital Health Mission comes into picture. So NDHM is being implemented as per the vision laid down in National Digital Health Blueprint, and we will be able to create an interoperable digital health ecosystem through two key steps. First is creation of common identifiers. As we know, any digital system identifies any stakeholder through an identifier. So we need a set of common identifier through which any person, any doctor, any professional can be identified across entire digital health ecosystem in a uniform way. Second is adoption of digital standards. When we talk about interoperability and data exchange across the ecosystem, it is very important that the data is in conformity to prescribe standards. Only then different systems will be able to talk to one another. So, in short, that is the gist of National Digital Health Mission. And National Digital Health Mission seeks to create a core ecosystem, core building block, on the top of which various value-added services like telemedicine can be provided. So let me give one example how this mission is going to facilitate telemedicine. On one side, we have patient. On another side, we have doctors or healthcare service providers. So how does a platform called telemedicine platform connect these two persons? The first step is eKYC. That means the platform should be able to identify the individual who is seeking the treatment, and the platform should be able to verify the credentials of the doctor or a healthcare professional who will provide healthcare services. So once we fully implement National Digital Health Mission, this platform should be capable of various kinds of services, including eKYC, and that way this will give a major boost or support to value-added services like telemedicine. So that way, this mission is very critical, and this mission is going to give boost to a sector like telemedicine. Now, the utility and importance of a sector like telemedicine can never be underestimated. If we see the condition of medical services in India, there is issue of availability of doctors across the geographical span of India. Second is availability of doctors with requisite skills at desired place or at desired time. So if we are able to leverage telemedicine, naturally this gap in delivery of services can be filled up to a great extent. So there is absolutely no doubt that telemedicine is a potential sector. There are already various applications which are catering to this requirement, including e-Sanjeevani, which is a great initiative, and it is already catering to telemedicine needs. But at the same time, we need to create an ecosystem where everybody, government sector, private sector, any kind of service provider located anywhere in India should be capable of providing such services. At the same time, people located anywhere in India are able to get required services. So it is not a simple task. It is imperative that we create an interoperable ecosystem where different systems are able to talk to one another, and we don't live in silos, in islands of digital intervention. That is precisely the objective, one of the key objectives with which National Digital Health Mission has been launched, and it is going to give a major boost to value-added services like telemedicine. Thank you.
Thank you very much, Mr. Kumar. Is there any question to Mr. Kumar? As I explained, he has a prior commitment because of which he won't be with us till the end of this session. So if there are any questions, please let me know by a raise of hand. If not, then thank you very much, Mr. Kumar. I'll request you to stay on for as long as you possibly can, because you'll be able to hear the industry panelists' views on the medical travel impact that COVID has had on them and the value add that telemedicine can bring to not just the industry, but also to the country and to the international patients that the country serves. Thank you very much for your inputs. May I now request Mr. Vikram Thaplu, CEO Telehealth Apollo Hospital Group, to kindly speak his bit. Apollo has been in the field of telehealth for a very long time, we all know. Those of you who are joining us from the international platform will know that Apollo is the largest group which is available in the corporate sector in healthcare in India. So, Mr. Vikram Thaplu, it's all yours now.
Namaste, everybody. Thank you, Dr. Narottam. I think it gives me immense pleasure to speak on topic of telemedicine, its opportunities within the medical value travel. So interestingly, yesterday we completed 21 years of telemedicine in Apollo system. It was on 23rd of March 2000 when first setup was inaugurated in India by the then president of US, Mr. Bill Clinton. So from that day till now, I think we have been working towards how telemedicine can be, more useful in domestic and international sectors. We all understand that medical value travel or medical tourism is very significant for a country of like ours, and also according to certain reports, it's around 7% of the total tourism, international tourism, which happens to India is for medical reasons. India also ranks among the top 5 in medical value travel. And I think that itself puts us in a place where we have the market share at the same time the responsibility of delivering the quality healthcare. Within Apollo, I think, as Dr. Puri already said, we have been in this space for quite some time. It's been more than 2 decades. And with that, we have more than 12 million lives touched over telemedicine. And out of these 12 million, I think 1 million would be definitely what we look at is the international patients. So it started very simple. It started with, I would say, basic telemedicine, which is the pre-admission evaluation and post-discharge support. But as we moved ahead, it went on to a lot of other things. Today, medical tourism is not only a plain vanilla teleconsult. It also includes continuum of care where connected health devices are provided. Patients go back to their places. They are connected over mobile apps. They are connected over wearable devices. We at our monitoring center are able to look at their vitals. So it has helped further keep a connect between an international traveler for medical reasons and the service provider in India. So as we understand, India has an advantage of good clinicians, English-speaking practitioners and service providers. And to add to it, we have been kind of a little late starters in the technology sector, but we have leapfrogged a lot as a country. And with that, we have been able to keep the prices at check. And I think we provide services to the world at 1/10 the price in the developed nations. So that itself makes us responsible and I would say the market leaders in this sphere. As per some reports, India domestic market is expected to reach 5.5 billion this year. But according to other reports, it's around supposed to be the telemedicine sector is supposed to be around 6 million in year 2023. So if we look at what it has been doing domestically, also if I may add, we have seen close to 500% jump in as a country in consultations taken by people of over 50 years age. So which clearly kind of put us to think that age is not an issue in adopting the telemedicine overall. And distances have been, as we keep on saying, distances have become history and geography has become history. So that's what's helped us as a country. I have stats from my system itself where we understood that more women have consulted than men on telemedicine platform. Mental issues have been kind of consulted internationally during this time, specifically during the COVID times. And condition management has been a very, very important part of telemedicine as well. So I believe India's understanding, as one of our earlier speakers said, the IT sector being one of the forefront in India, along with the healthcare service providers and the medtech systems. So these three put together are probably going to keep us ahead of the curve in medical tourism. At Apollo, we also have been part of earlier wave of the Pan-African project, and I think the new avatar as e-Arogya Bharti is also significantly doing well. Yep, with that, I think I'll over to you, Dr. Narottam Puri.
Well, thank you so much, Vikram. It's wonderful to have you with us and give your views. 20 years is a long time of experience. And it is very important that we realize that in today's day and age, just as we are talking to one another, we have now the ability to talk to our patients based right out of where we are in whichever city that we may be as doctors to provide and help those who really need our help. May I now request Dr. Sujit Chatterjee, the CEO, or long stint serving CEO of the Dr. L.H. Hiranandani Hospital in Mumbai. Over to you, sir.
Thank you very much, Dr. Puri. And also, I would like to thank Vicky for having considered me to join this eminent panel today. Let me take a line from Dr. Puri in what he said about the best doctors in the world possibly come from India. And, you know, engaging with the best, you will get the best results as far as your health is concerned. I would like to start with the pandemic and what it has done for telemedical consultations, and then go on to the medical value travel. Now, you know, in Mumbai, as everybody would know, that the number of cases initially had, you know, really shot up, and there were a lot of concerns as to where we were headed. But the private as well as the government agencies got together, and we were in a position to, you know, really control the mortality, the morbidity here. Now, you all must be wondering, why is he talking about this? Because the Mumbai experience spread over the globe. And we started getting requests from overseas. Now, the place that really kicked off was London. And, despite what happened with the NHS and, people trying to ensure that they were controlling cases, we started getting consultations. And it started with the diaspora. And it, went on to even the local people bringing us up for medical consultations. And what we were able to do was, as far as the local as well as the regional areas were concerned, is to monitor. And this really significantly helped us because, the oxygen, the pulse oximeters were available with people. There is electronic blood pressure monitoring, which was available, and our doctors could actually consult people and give them advice as to whether you required admission or not. Because let me tell you, ladies and gentlemen, and Dr. Puri would bear me out, that beds were at a premium. Now, this was the learning, but this learning we were able to transpose overseas. And we started advising people on even a 6-minute test. And it was not really 6 minutes as it should be, but it was a thing that we could do very, very easily, very, very effectively, because the monitoring equipment existed on the other side also. Now, the consultations were paid for. And this too became, it's actually not that people traveled to Mumbai, but we were in constant touch with people, not only in the UK, in London, but we were in touch with people in Italy. Now, when they couldn't get assistance from their own healthcare system, they reached out from via to via. That means from somebody I know who knew somebody else, and they connected us. And this was quite common in Mumbai. So therefore, I think the infrastructure that has been created and the quality of care that India provides was something that really appealed to people all over the world. Today, again, talking in terms of the value travel, I would link it rather to the income. So therefore, I might be charging, a couple of pounds to the person who is overseas, and they can transfer the money across to us, and we have, a discussion. And also now the post-COVID consultation. So we have a joint clinic. We have a multidisciplinary team approach, which is so highly appreciated. For example, in the post-COVID clinic, you have a physician, a pulmonologist, a pulmonary therapist, that is a physiotherapist, as well as a dietitian. And the dietitian is there because of the comorbids, like, for example, diabetes. So therefore, people who have, uncontrolled blood sugar levels, listen to the dietitian and what it is that you need to practice. So therefore, this is a part that is highly appreciated in places where they cannot get this help at the drop of a hat. So therefore, we are spreading this very confidently that we may be able to monitor you. We may be able to give you post-therapy advice, but you may not be able to actually be in contact with us. That is the physical contact. So I think that, India has done remarkably well in the field of, we as Indians are possibly the most intelligent race in the world. I mean, I don't want to be grandiloquent, in this by saying that we are the most intelligent race in the world. It's been proven often enough, and you can see in the United States, the basic administration is all Indian. The space programs are so much more with Indians, and including their sound systems, which are assisted by Indians for communication. So therefore, let me take that and say that people who want to consult us should travel to India when the COVID menace dies down for the best possible treatment. And I think there is a huge measure that we can do by actually inviting the insurance from various countries to tie up with the government of India or private players and have their insured patients come across for therapy. The question is basically complications, and we should cross the bridge when we come to it. So I think this is what I would like to say, that medical value travel is something that is going to take off, because when you get the best, at a particular price, and you're getting the best intelligent minds coming in for your therapy, then I think you have a winning combination. So when you have a winning combination, I don't think it's going to be so hard to sell to anyone in the world. Yes, we are with the pan African countries, yes, but we should be with the Pan American countries and also Europe as well as Australia. So thank you, sir, Dr. Puri, for giving me this space to put my views across. Some of it maybe have sounded a little radical, but I think we are a growing medical power to be reckoned with the world over. Thank you, sir.
Thank you, Dr. Chatterjee. Incidentally, Dr. Chatterjee is in Mumbai at the Hiranandani Hospital. Dr. Hiranandani was a very noted ear, nose, throat, and head and neck surgeon of international repute. Just a piece of trivia. He was my examiner in the Master of Surgery exam, and I worked with him. So great having you with us, Dr. Chatterjee. Over now to my old friend, Dr. Vishnu Panigri, who is a cardiac anesthetist of international repute. He has been virtually everywhere. He's worked with Apollo, he's worked with Max. He's currently the group medical head of Fortis Healthcare, which is the second largest in terms of number of beds in India, and runs several entities, not just in India, but abroad too. He has a vast experience of being a medical administrator. So over to you, Vishnu, to hear from you the way forward for the medical tourism industry to recover in this country and to provide succor to our international patients through the use of teletechnology, telemedicine. Please unmute yourself.
Am I audible now?
Yes, you're audible now.
Hello. Thank you, Dr. Puri, and thank you, Vicky, for giving me, on behalf of Fortis Healthcare, this opportunity to participate in this medical value tourism talk. And what I'd like to say is that we are grappling with access and affordability across the country as far as healthcare is concerned. But over the last couple of decades, we have seen significant progress. And I think so the private sector has stepped forward, and especially on the medical value travel, they have done significant progress there. We are seeing a lot of patients coming in from neighboring countries and even from the African countries. And this COVID, I think so, has given us a time to introspect on where are we, what do we do from now. So I think so this is a good platform to sort of discuss and sort of put up the points across that what we are doing and what we need to do. So while we look at this, I think so the digital health partnership and capacity building is something that we must focus on. And obviously it delivers primary and specialized healthcare to geographically isolated patients. It does address the discrepancy between geographic locations. And what we should be applying to is actually some things like the tele-ICU. And on this, I would like to actually mention that Fortis for the last decade or so has been running tele-ICUs with headquarters from Fortis Escort Heart Institute at Okla and also presently from Fortis Memorial Research Institute at Gurgaon, catering to a number of ICUs in northern India. So what is the advantage? It gives you a 24/7 intensive care backup because critical care specialists are not regularly available everywhere. The numbers, so even if you have a lean staff, from here we manage it. So the remote monitoring happens, advanced consultations happen, and thereby we are giving better care to the patients. Outcomes are much better, reduces length of stay, reduces the antibiotic usage, because a lot of times in the smaller ICUs, the antibiotic usage is humongous. So as we say that we should be knowing the correct way of antibiotic usage, of when to de-escalate. So all these things do come in. And this COVID has actually also given us an opportunity to enhance our space in the teleconsult. So across the healthcare sector, whether it's private or public, teleconsults have improved, but we need to sort of step up on this so that the value proposition, both for the patient and caregivers, do come in. They will improve the outcomes, improve access, and also patient safety, because unnecessary visits to the hospitals can be sort of curtailed, and thereby you prevent them from picking up unnecessary infections, which when elderly patients or patients with a lot of comorbidities, they have to come repeatedly. So these are the things which I had in mind. And on the tele-ICU part, I did mention about that. The others which really have a role to play for the future are tele-radiology, because this is a huge bucket that the government of India, FICCI, and the health sector in general can sort of work around. How do we enhance teleradiology? And because we have very good radiologists in the country, so by this tele-networking, you can get images here, report it. It's already happening. Centers in Bangalore are catering to major radiology centers in USA, where the reporting is done in Bangalore. So this is something that we can harness. Tele-nephrology also, like a lot of home dialysis systems have started coming in. So how you can manage them properly. Telepathology is another thing. Again, when you look at the geography outside India also, or within in India, getting good pathologists to interpret the specimens, whether it is is not very easy. So if by this telepathology thing, we can sort of get the right people to interpret, and the treatment can be better, outcomes can be better. Another thing which actually is impacting Indian healthcare, I think so, is that going forward, if you from independence, if you look at it now, prior to independence, more than 50% of the deaths were from communicable disease, but it's not so now. It is just twisted now. The more is from the non-communicable disease. So how do we take care of that? A lot of the non-communicable disease, whether it is the diabetes, hypertension, they can benefit from this telemedicine, whether the Indian patients or the ones we're talking about from outside the country. And the other part which we always lose out is the mental health. Mental health is increasing by leaps and bounds globally. It is a WHO call out. So telemedicine will be a huge benefit to them, because they can log in, they can consult their psychiatrist, they can be counseled. So this is something that we need to focus on going forward. The areas that need attention, which I would like to bring up, is that I think so we don't have a proper international legal framework for the health professionals. So this is something that we need to look at. There are multiple jurisdictions across geographies. How do we address the medical liability and patient privacy and confidentiality? That has to be maintained properly. So these are certain things that we need to look at. And for dispute resolution, how do we go about it between the provider, patient, and the payer? So these are things which I like to request the FICCI and the government authorities to help us on. Reimbursement was brought up earlier. Insurance penetration is increasing, whether it's in India and also abroad. So how do we sort of reach out to some international insurance providers who can help us in this? Because this is going to be a very important segment going forward. Then the other thing that we'd like to say is that if you look at all the healthcare providers, getting a medical visa is an issue. it's a problem. And how do we use our Indian embassies or high commissions outside the government of India, Ministry of External Affairs, to make it much more seamless and more patient friendly to them. The other thing that comes in also is when they come in with $5,000 only. Not everyone is adept at wire transfer. Some countries do have a proper wire transfer, but many of the countries which come from some of the Gulf countries, in other words, Iraq and then some African countries, they are not adept at wire transfer. So they can't come with more than $5,000. So this is again another thing that we need to sort of address, because this segment is going to increase, the medical value tourism that we're talking about. Because as some of our earlier speakers mentioned, Indian doctors have been recognized as the best. So the access, affordability. So the affordability part is being addressed by the Indian health ecosystem and the doctors. But we need to provide a proper way so that they feel that there are less hassles for them to come into India. So these are the things that are coming in and are nitpicks that we need to sort of take care of. The other thing which I'd like to request is that we have embassies, high commissions across the globe, and let us focus on the countries from where most of the patients are coming. And can we have a teleconsult room there? So if the teleconsult room is in an embassy compound or wherever the authorities feel. So irrespective of whether it is a Fortis or a Apollo or a Max or a Medanta, whatever it is, they can log in and and then consult the doctor. So this will help to sort of integrate it further. And the other thing is on standard consents. So my request will be that whether FICCI has with NEBH or a standard consent process has to be built in. And the last part before I complete is that we need to have self-regulate ourselves. So my request will be that FICCI, if they sort of say NEBH these are the parameters that need to be followed, and these are things that we need to adhere to, because quality is most important. Because if we just for the sake of quantity, we start focusing on that and don't self-regulate ourselves, in the long run will hurt us. So let us look at the long-term perspective and see that we regulate ourselves properly. So some sort of self-regulation has to be there, like the NEBH standards that are there. Something for the international thing, this is the medical value travel. What are the things that need to be in place? So it will be seamless across whichever provider is there. And the last part which I want to ask is that, can we have a standard data set for patient data set? Because now everyone enters the data in their own way. So the standard data set is there, that will have immense implications. One is that looking at the health status of the patients, looking at studying the disease prevalence, planning going forward, economic planning will happen that way. So these are things that we need to have in place. Sorry. We've been talking about patient data, but a standard data set is not there still. So my request to FICCI will be to see that we have a standard data set which across the healthcare space, everyone starts using it. So that will help in a huge way to take things forward. And while we keep focusing on the medical value travel outside the country, my request is that India is growing. The middle class is expanding. Even if you look at the Indian hinterland, the affordability is increasing. So we must look at that from the NCT perspective, diabetes, hypertension. So how do we sort of have some pockets there so that the teleconsult happens properly, so they can sort of consult that the doctors, whether it's in the district headquarters or the state headquarters or to the major metros. So these are things that we must focus on. With that, I'd like to end. Thank you.
Sorry, by mistake, I went on mute again. Thank you, Dr. Panigri. Some very important points that you raised, particularly about telepathology, teleradiology, being areas that we can focus on. The second part that you mentioned, which was slightly out of the box, was the construction or location of a teleconsult room within the High Commissions of India particularly from countries from where patients flow in. That's certainly something worth pondering about. As regards the NABH that you mentioned about the health standards, well, NABH has digital health standards guidelines which have been published recently. They are available. And as you all know, that NABH is a part of ISQA now. So NABH certification or accreditation is equivalent to any other international accreditation. Therefore, it's very important for us to keep on emphasizing that India is not just value from the value part of it. India provides good quality at much less price than any other competing country. That has to be re-emphasized over and over again. Thank you, Dr. Panigri. May I now request Dr. Harsh Rajaram, who is the CEO of Astra Health Telehealth, Astra DM Healthcare. As we all know that Astra DM Healthcare is a very huge entity, not just in India, but also in the GCC countries. So it will be interesting to hear what the CEO of Astra Telehealth, Dr. Raj Gopal, has to say for us. Over to you.
Thank you, Dr. Puri, and thank you, Vicky, for the opportunity to provide a perspective of on the subject of MVT and telemedicine. For us at Aster, it has been a great learning period in the COVID, as it has been for many across the world. And as much as many of us have taken a digital leap in the way we lead our life today, Aster also has taken a digital leap in the way we look at healthcare. And for us, it has been, going beyond the boundaries of the physical infrastructure, what we had built across 9 countries today. And it has been experience taking the services beyond our boundaries. And we, during this period, we have done about 125,000 consultation and nearly touched 10,000 teletriage. And like the previous speaker said, it has been a learning for us in also providing services in tele-ICU and tele-radiology. It gave us an opportunity to help our colleagues between our geography to help them in tele-ICU and tele-radiology services. Not only that, I think it also helped us extend our services even in India to peripheral hospitals in assisting them in tele-ICU services. I think in addition to what we have been doing, I think this COVID period, as much as it has impacted the world in a wrong way, it has also provided us a great opportunity to leverage it in digital space. And as many speakers prior to me have said, that we are the medical power, we have established ourselves as an IT powerhouse. And the recent vaccine diplomacy we have advocated and got a lot of goodwill. I think it is a great time for us to become a powerhouse for telehealth also. And I won't repeat many points which the previous panelist has said. Just to add to those, I think it is time that we as a sector and FICCI and the industry come together to establish ourselves and establish credibility, as what we have done in MVT space in creating M-visas, green channels in airport, or easing the standards for facilitators to enroll. I think it is time that we also have some set of standards in provision of telehealth services to other countries. Recently, I was also part of a workshop held by the Portuguese presidency, where they had interestingly set out a role for cross-border telehealth services and taken a lead to ensure that there are some standards established in European Union for cross-border telehealth services. I think India can take a lead in the countries where we operate today, where we get medical value travel, where we can co-opt and lead a workshop to establish credibility, and also have exchanges where we can help in data management in terms of licensing, I think that would give us a great leap in how we can provide services to other countries. And in addition, I think in the space of telepathology, teleradiology, we have already established norms and established guidelines. I think it is time we start extending the services to other countries, and hope FICCI and the government will establish a platform where we can collectively establish standards and credibility to get into those services in many other areas. Thanks for the opportunity.
Thank you, Karthik. Again, food for thought that you've provided, particularly from the knowledge that we've gleaned from your talk. There is something that FICCI MVT committee will take note of, particularly from what you've told about the European system. Thank you very much for your inputs. May I now request, so I'm sorry, I now call upon Karthik Rajgopal. I confused thanking in name Mr. Dr. Harsha Rajram. Thank you very much for your inputs. Mr. Karthik Rajgopal is the CEO of Manipal Health Enterprises. Manipal is again a huge player in the Indian scenario, having several hospitals in many states of the country. And we would love to hear from him the concluding piece from the industry stalwarts that you've heard so far. After that, time permitting, we'll have a 5-minute Q&A session. Over to you, Karthik.
Thanks, Doc. Like your cricket commentary, I'm either bowling the death over or the 11th man in. I think most of the speakers have actually gone ahead and spoken. I have nothing more to say except that what's actually happened to our industry with the pandemic is that the digital acceleration has probably leapfrogged by almost about 2-3 years. What was supposedly taken for granted, and we believed we had the time. Today, we didn't have that, and obviously, digital health as a whole is definitely going to go ahead and work very well for the healthcare industry, both within the country as well as outside. Specifically with reference to telemedicine, I think the biggest advantage is it builds up trust and it builds scale. And most international patients are patients coming in within the country around for inward medical value travel may or may not have got access to actually going ahead and meeting the clinician whom they're actually going to go ahead and consult. So there would be that fear, that intimidatory factor, etc., which can actually go ahead and be put to rest when you're really able to put a face and a voice to the name as you start to go ahead and consult. Internationally, obviously, the role of a teleconsult is much beyond just the pre and post-operative care. If you have to go ahead and take it to a very, very large extent in terms of e-learning, as well as our ability to actually go ahead and help nurses and clinicians there probably perform straightforward surgery. So the opportunities around the digital health space is huge. We've done close to 100,000 video consults in the last 12-13 months of the pandemic, and our results so far have been fantastic. Many patients have actually gone ahead and appreciated the fact that even without actually moving away from the comfort of their homes, they've been able to actually go ahead and be reasonably satisfied with the outcome of this consultation. Obviously, a large part of healthcare will still continue to remain touch and feel, because the surgical or the medical intervention will need to happen at a distribution point, which is the hospital. But outside of that, if you actually go ahead and look at the diagnosis, the ability to actually go ahead and look at providing the post-operative or post-admission care, I think the opportunities are actually tremendous. We've built in an app right now as part of the digital health. Teleradiology is something that people have gone ahead and, my previous speakers have gone ahead and spoken about, similar with pathology as well. And I think we are in here for very, very interesting times where the mind is now going to go ahead and think very, very differently. From what was supposed to be 100% physical industry, we will probably move into a 70-30, 70 physical and a 30 virtual industry. And I think that's very, very interesting times ahead. And as far as medical value travel is concerned, if there is something that we should be doing with the kind of capability that we have and with the kind of clinicians that we have,
the India piece, that the brand India, like how Singapore Medicine has actually gone ahead and branded itself. I think that is something, if all the players can come together, offers tremendous opportunities for us to go ahead and position ourselves as position India as the place for medical tourism, because it's probably the first world quality at third world prices, and I think that tagline is very, very well fit for in India as a country. And as far as telemedicine is concerned, and congratulations Vikram for having completed 21 years. Actually, when Apollo started off the entire telemedicine initiative, the entire tagline was, geographies now become history, and I think holds for the entire globe to actually be coming together. So thanks, Doc, and that's the one I could actually go ahead and talk about.
Thank you very much, Karthik, for being brief, to the point, and giving food for thought, particularly from the perspective of the likelihood of what is going to be the future of healthcare. It may well become a hybrid model, as you say, 70-30. But from the perspective of the India positioning, I think you are absolutely right. FICCI, through its Medical Value Travel Committee, has been for long propagating this, that whenever we are projecting ourselves abroad, we have to give a comprehensive picture of the Indian healthcare scene, which, as Dr. Sujit Chatterjee mentioned, as Dr. Vishnu Panigri mentioned, as many of you have mentioned, has excellent medical facilities and world-class medical doctors. So there's no reason why, instead of competing, we should not be together in projecting India as a unified whole to provide for medical care to those who need it most. We have just time enough for a few questions. So in case there is anybody who's interested in asking a question from any of the government or the industry representatives who have today given you their thoughts about the way medical value travel industry is going and is likely to go, and likely impact that COVID has had, resulting in telehealth being projected as one of the major areas which can help alleviate suffering. So any questions? In case you don't, please allow me to close this session. But in case there are any questions, do feel free to either contact us at our address, which will be known to you by now. If not, you can contact us during the course of the next 2 days when the MVT sessions will be on. From the perspective of today's sessions, do join us for the rest of the evening, and then tomorrow and day after. So may I, with the permission of Praveen Mittal, hand it back to him to take this forward. Over to you, Praveen. Over to you, Praveen. I think Praveen is on mute. Before I do that, then, let me take the opportunity to thank each and every one of you who's taken the time out to contribute so immensely to the knowledge bank that we have about medical travel. It is no doubt the most important recognition of the worth of medical travel as an industry that, as I mentioned in the beginning, the Niti Aayog having included it in the promotion of just 12 of the entities that have been selected. So therefore, from the Indian perspective, it has a huge impact which is likely to be made. India affords this opportunity to everyone to participate from the perspective of contributing to the alleviation of suffering all across the globe. The COVID pandemic isn't going away. Therefore, we are forced to take a relook, as one of the panelists said, into the way we conduct our business. That is the business of providing succor to so many all across the globe. So thank you each and every one of the panelists today. And may I now hand back the mic to Ishan Pandita. Ishan, over to you.
Thank you, Dr. Puri. Thank you so much for moderating this wonderful inaugural webinar that we had on telemedicine. On behalf of FICCI, I would like to thank you all of you who have joined us as guests. We look forward to have your presence in the other sessions, which will be there tomorrow and the after. And we also have a virtual exhibition. I would request all of you to kindly join the virtual exhibitions. Many of the current exhibitions have joined. They will be there as a business visitors. Over 100 exhibition stalls are there from leading organizations. So I would like to thank you all. With this, may I request IT to close the session? Thank you all.